So, hello everyone. We are talking about a radiology subject. So, today we will discuss about one important system, that is skeletal system or skeletal-muscular system. Okay. So, this is very important topic. So, we are going to discuss about the diseases according to radiology. Okay. So, the most common type of pathological conditions, mostly in our clinic, the patient comes with pain. Okay, pain in knee joint or back pain, cervical pain. Okay, all other joints. So what is the basic term we use for this joint pains? We will call arthritis. Arthritis. So basically it is very common in our clinics. So we'll discuss about the arthritis, not arthritis disease, how it occurs, pathology, that kind of thing. But according to radiology, what is the important things? What is the investigation of choice? What is the different types of arthritis? How it's look like in the X-ray? What is the normal knee joint anatomy? Okay, and normal X-ray, how it is looks like. So everything we will discuss gradually. So basically, uh, in the arthritis, so basic investigation of choice is X-ray. Okay, X-ray, we are going to see the bony structure. So there's the reason the investigation of choice is X-ray. But we have other related things in the joints like tendon, ligaments, and articular. Okay, and as synovial fluid and bursa, everything is there present in the knee joint mostly. So what is the investigation of choice for to see all this other structures? That is MRI. MRI is the investigation of choice, okay, for to diagnose all this related problem. So what is arthritis? So basically the arthritis means the inflammation of joints. Okay. So the hallmark, what is that? The hallmark. How to identify the arthritis? So it is a reduced joint space. Reduced joint space. This is the hallmark of arthritis. Means there is two joints. The space is reduced, means that is arthritis. So it is very important thing we have to understand. And we have to know that two to three terms also. We'll discuss later. Okay. So let's see the X-ray basic anatomy, okay, of the knee, because we have most common uh, painful condition that comes in your clinic is that knee pain. Okay, so that's the reason I am explaining here. So you can see that's knee, every joint had this number of things are there. We have to remember that. Number one is bone. So we know the names of the bone here, any joint or any area. Second is muscles. We have to know which muscles are present. Then we have to know the ligaments. Then we have to know the tendons. And that we have to know about articular surface, articular area of or nerves present in that area. Okay, and the fluid present in that area and other things. Whatever other structures are present in that area, we have to know that. So let's see this image. We'll able to know. First is femur bone. This is the knee joint front. From front view, we are seeing this knee. So here we have bone and we have this muscle and ligaments. Okay. You can see that this is a femur bone. Femur bone, till here you have the femur bone. This is the tibia bone. This is the fibula bone. Okay. It is outside. It is inner side. Okay. It is the inner side. Medial side is the lateral side. You can see this is the one muscles, quadricep muscle, and it is attaching here tibia, and it is tendon. Okay. You can see this is the ligament, lateral lateral collateral ligament, medial collateral ligament. Okay. This is one anatomical structure of the knee. Second, you can see this here. This is very detailed. Okay. You can see this is the femur bone, tibia bone, and fibula bone. You can see this is the patella bone, front patella. Okay, this is the back side, this is the front side, patella. And you can see femur lateral condyle, medial condyle. Okay. And this is distal end of femur, and this lateral condyle of tibia, medial condyle of tibia, head of fibula, neck of fibula, shaft of fibula, shaft of tibia. So all these are this backside, same medial condyle of femur, articular surface. What is that? It is the cartilage. Between two bones, we have cartilage. That is articular surface. This is the articular surface. This is the medial condyle, lateral condyle, head of fibula, neck of fibula, end of tibia, shaft of tibia, shaft of. This is the knee joint anatomy. Next, we have that. We have to know this is the meniscus. Parts of the some parts give strength to that bone. Okay, meniscus is that. So you can see this is the one meniscus, medial meniscus. This is lateral meniscus. In that we have articular cartilage. This is the articular cartilage, and this is the ligament. Okay, anterior ligament, posterior ligament. Okay. Next image. Most important in the knee joint is synovial fluid, which maintain movability, free movability. Okay, movable joint. You can see that. You can see this is the bursa, where the fluid is there in that particular area. All these are called. This is the synovial joint. Okay, and this is the articular cartilage. Okay, synovial membrane is there. And that in the above we have fibrous capsule, very strong. Okay, to maintain the joint space. In that we have the synovial fluid. So very, very important for mobility. So these are the things we have to know about the basically the knee anatomy. So you can see here normal X-ray. Okay. So this is the femur bone. Okay, we already seen, and it is the lateral epicondyle. This is the medial epicondyle, and this is patella here. First, what is the first thing you have to check? That is space. Okay, so space, joint space is normal. Then the mostly X-ray is normal. So the reduction of joint space is nothing but arthritis. You can see patella. This is the interchondral eminence. This is tibia, fibula, head of fibula. This is medial condyle. Okay, medial femoral condyle. Okay, all these are X-rays. Next image I will show you. This is the another. So you have to say medial condyle, lateral condyle, patella, and this is cartilage. Okay, articular cartilage, tibia, plateau, lateral tibia plati, fibula and tibia, tibial spines. These are the spines. And this is the patella. So hard tissue images you can see in the X-ray. For the soft tissue images, you need to do MRI. So this is the one part of our class. Next, what we have to understand about that, that is osteoarthritis. Osteoarthritis is the most common. Okay, osteoarthritis is the most common type of arthritis. So we'll discuss about different types of arthritis. So we have three types of arthritis. One is inflammatory. Second is non-inflammatory. Next is depository or mineral. Okay, so let's discuss about one by one. Inflammatory. In the inflammatory, we have two types again. One is rheumatoid arthritis positive, rheumatoid arthritis negative. So it is rheumatoid arthritis. Next is negative. Patient have inflammation, but as tested, they are negative. So in that you have two types: pseudo arthritis and ankylosing spondylitis. Spondylitis. Okay, inflammatory condition. Next is non-inflammatory condition. In the non-inflammatory condition, we are also called degenerative. This is the most common in old age, like osteoarthritis, okay, neuropathic joints, okay, okay, these are the common. Next, we have depository arthritis. Depository arthritis in have gout and pseudo gout, okay, all these types. Okay, these are the things we have to remember. So there are five things where we are seeing the X-ray. We have to remember, okay, to understand whether it is inflammatory or non-inflammatory, whether it is inflammatory or non-inflammatory. What are the five things? First is age. Okay, it is very important. Second is joint space. Third is periarticular. Fourth one is osteotype, osteophyte. Fifth one is erosions. Okay. Age. Inflammatory is mostly in adult. Okay. Degenerative is mostly elderly. So if a 60% year comes with joint pain, so mostly it is non-inflammatory degenerative. If a younger person come with the pain, it is inflammatory. So we have to uh, know about that. Joint space in the inflammatory, the joint space is reduced bilateral, symmetric, means both the side. Like if it is the normal X-ray of the knee, so you can see this is the medial, lateral, this is medial. So if one side you saw anything, pain or reduction of space, so it means it is degenerative. Both side means it is inflammative. So this is the thing we have to remember. Okay, bilateral, it is symmetric. It is asymmetric, one side. Non-inflammatory because of weight bearing joints. So mostly knee joint, pelvic joint are affected one side. Okay, medial side, mostly medial side or lateral side. Here you have the periarticular osteopenia is seen. Okay, in the his sclerosis. Okay, in the osteophyte, there is no osteophyte in inflammatory. Yes, presence of osteophyte here. And erosion is presence. Yes, here no. Okay, so these are the five things we have to remember. So these are the things we have to remember. So today we discussed about anatomy of knee and what are the different types of arthritis. Okay, and what the things we have to remember while seeing an X-ray. So to differentiate that is inflammatory or non-inflammatory. So this is all about in today's class. We'll continue tomorrow. Okay.